Hello everyone, welcome to another interesting episode of the Anti-Pharmacist podcast. For those that expected to hear my voice on Friday and didn't, I sincerely apologize. But like I said, for now, it's just me on this podcast doing everything. I was trying to marry a lot of things together, but it just didn't work out that day. For that, I apologize, which is why I'm here today, determined not to disappoint again, okay? And of course, I have something good to discuss with you. Good? Well, it's not like it's a good news or something, but there's actually a silver lining to it. Well, what I'm talking about is that yesterday, being June 8th, was World Brain Tumor Day, okay? And I just want to bring to your notice, awareness about this disease. I know I've talked about cancers a lot on this podcast, but you know that part of the cure is actually knowing these things and preventing it. I've also talked about how prevention is better than cure on this podcast, okay? So without further ado, let's just get right into it. So like I said, June 8th is marked for commemoration of World Brain Tumor Day. And we know that brain tumor is a kind of cancer. For so long now, I've talked about cancer on this podcast, how cancer is the bane of the 21st century. How cure has not been found for it because it is very versatile, it is very ubiquitous, it is everywhere, can infect every cell in the body, even those ones that you do not pay attention to. Talk about Hannah cancer, imagine Hannah, but it happens. So today I'll just be talking about brain tumor, which is brain cancer, the prevention, the risks. We can't really say causes because these things sometimes do not even have causes, they just have risk factors. And I'll just be hinting on the recent developments in combating this deadly brain tumor, okay, this deadly cancer, because cancers are generally deadly, but cancer of the brain is on another level, guys, on another level. You know that for sure. And I'm glad that I've done series on the Time 100 Health list, which I just finished actually. I talked about how scientists have been doing a lot in terms of cancers, although there was no highlight for brain cancer there, right? There was 4 lung cancer, but that doesn't mean that scientists are not working on brain cancers as well, okay? So a brief history of World Brain Cancer Day. It actually started in Germany, okay? This commemoration, the decision to actually mark it was established on June 8th, 2000. That was 25 years ago, to honor and support brain tumor patients and their families globally. This date was chosen because on June 8th, 1952, Professor Martin Lewis of University College London diagnosed the first recorded brain tumor case. That's cancer of the brain. It could happen in any part of the brain, the anatomy of the brain, okay? And what's the significance of World Brain Tumor Day? It is observed annually, like I said, to raise awareness about brain tumors. And the aim is to inform people about the symptoms, the diagnosis, the treatment options for brain tumors, to assist the brain tumor patients and their families, to foster research and progress in brain tumor treatment methods, to champion improved healthcare access and support for individuals impacted by brain tumors, and to motivate early detection and intervention to enhance patient outcomes. Now, what is the theme for 2025 World Brain Tumor Day? The theme is United for a Cure, Advancing Research, Empowering Lives. So the theme actually emphasizes collaboration, among researchers, caregivers, medical institutions, and communities to accelerate breakthroughs and improve the quality of life for those affected by brain tumors, okay? That's the major reason for that theme. And many things are done for this: health camps, free screenings, patient support programs, fundraising campaigns, education seminars and webinars, awareness walks, marathons, and all of that. But this is my own way of actually celebrating or commemorating this day, which I always do for significant World Health Days. So I'm raising this awareness for my listeners who I trust that will actually share this podcast with their families and friends. Okay, it could be anybody really. Like I said, there's no particular cause for cancers. We only have risk factors, and it could happen to anybody, no matter how healthy you eat, no matter how careful you are. That's why we just advise that do your best. Okay, so that you can say from your own part that you did your best. It's not because of your lifestyle that you got it. Okay, yeah, it could happen to anybody, from the richest to the poorest, from the most knowledgeable to the least knowledgeable or educated, from medical professionals themselves to non-medical professionals. Okay, just do your best and hope for the best. Really, that is it. So I'm here to educate you on what brain tumor is, the risk factors, how to prevent them, because awareness is the first step in the journey of change. Right. So what exactly is brain tumor, and what are the risk factors I've been saying that I want to talk about? So brain cancer is also brain tumor, and it refers to the growth of abnormal cells within the brain. It can arise from both primary and secondary sources. Primary brain tumors being those that originate in the brain, while secondary brain tumors are known as metastatic brain tumors. That is, they occur in other primary sites, other parts of the body, then spread to the brain. Yeah, you see, every cell is supposed to have a function, a particular function which it carries out in the body. We know cells are basic units of life. They belong to tissues. Groups of cells are tissues. These tissues belong to organs, and these organs belong to systems. Our bodies function because of these different specialized systems. But tumors are just bunches of cells, that do not have a specific function. They're just there occupying space and causing problems. Exactly, that's what tumors are. So some of them are benign in the sense that they're just there, not really dangerous, while others are malignant. That is, they can cause a lot of disasters if care is not taken. They can even move to other parts of the body, to other cells, to other systems, and cause problems there. Do you get? There are many types of brain cancer, really. It can primary, secondary, like I've said, and they are classified based on the cell of origin, biological behavior of the cancer. Biological behavior being if they are benign or malignant. Benign being maybe harmless, maybe just a tumor that may not constitute much problems, while malignant is one that can be potentially fatal, that is, can cause death, and it can spread even to other parts of the body from the brain, right? And based on cell of origin, we have astrocytoma. It's usually common in children, okay? And there are different grades to it. There's glioblastoma. It's like the most aggressive form of astrocytoma, okay? It's the common primary malignant brain tumors in adults, and it's from the astrocytes. That's the star-shaped glial cells that support neurons in the brain. It is the most malignant, so most researches have been directed to this particular type of brain cancer over the years. There's oligodendroglioma, there's ependymoma, okay, there's medulloblastoma, primary cell nervous system lymphoma, there is brain metastasis. All of these are just primary brain tumors. They arise from different parts of the brain, really. Meningioma, for example, is from meninges. That's the membrane covering the brain. Astrocytoma from the astrocytes in the brain. Oligodendroglioma from the oligodendrocytes in the brain. Those are just anatomical terms. Yeah. So there are also grades to cancer brain tumors. There is grade 1, which is benign, slow growing, often curable with surgery. Grade 2 may be a bit infiltrative, and there is potential for recurrence and progression. Grade 3 is malignant, more aggressive than the first 2 grades, and it's likely to recur after remission, after surgery, or after chemotherapy. And grade 4 is highly malignant with rapid progression and poor prognosis. That's the glioblastoma, okay? So there are many things involved in brain tumors which I will not want to get into, okay? But let's talk quickly about the risk factors of brain cancer. The causes, like I said, are largely unknown, but there are several genetic, environmental, and lifestyle-related factors that have been implicated in the development of brain cancers. Yeah, they may arise from mutations in genes that regulate cell growth, repair, and death. That's genetics. And this mutation can lead to uncontrolled cell division and tumor formation, just like in any other cancer. There could be gene alterations, gene deletions, and all of that. Some may inherit genetic syndromes like Turcot syndrome or neurofibromatosis, which increases the risk of developing brain tumors. Okay, researchers have proven this. Then there are environmental exposures, even though they are not really well established, it is suspected that the environment plays a role. Exposure to radiation has been found to be a risk factor for cancer of any type, really. Yes, especially for those that have undergone radiation therapy, those that have been exposed to radiation in one way or another. When I talk about radiation exposure in this our technologically advanced world, it's not something that is far-fetched. You shouldn't be thinking Marie Curie and level of exposure, right? Your phone, your laptops, even your TVs, because we have smart TVs now, they all have radiation, telecommunication masts near you, electromotive or electromagnetic forces, all of these carry radiation. Even UV rays from the sun, that's a kind of radiation. So do not even think that it's until you visit one lab where they use radioactive materials. Radiation is all around you, and we should limit our exposures to them to the minimum. I don't know how this can be done, but that is telling you to reduce your screen time in whichever form. Okay, reduce your exposure to radiation as much as you can, because this is a potential risk for brain cancer. This exposes you to probably developing brain cancer, God forbid. Age and gender also influence the risk, but to what extent is not really proven in research, because tumors and cancers can occur at any age, but they are usually more diagnosed in older adults. Yeah, and there are some that are actually gender specific too, like meningiomas. They are more common in women, while glioblastomas are more common in men. Then immunosuppression is another factor that can lead to cancer, especially brain cancers. People with compromised immune systems, like those with HIV and AIDS, or those that are on long-term immunosuppressive therapy, they may have higher risk of getting brain cancers, especially the primary ones like lymphomas. Okay, then lifestyle could also contribute. Cell phone use, dietary habit, not eating healthy, but then research hasn't really proven them. But like I said, do your best, leave the rest. Really, just live as healthy as you can to avoid any kind of cancer at all. Now to the symptoms. You see, symptoms of brain cancer can vary very widely depending on the type of tumor, the size, the location within the brain. And you know that the brain is like the CPU of the body. While the heart is the engine, the brain is like the central processing unit. So it controls many vital functions of the body, from your speech to your behavior to your movement, and any disruption caused by tumor growth can lead to a wide array of neurological or physical issues. The most common early symptom of brain cancers are headaches. They may worsen over time. Some are more severe in the morning. Of course, you know that I'm not saying that when you have headache, it automatically means that you have brain cancer. I've mentioned many times on this podcast that headaches can be a symptom or a sign of many different conditions, even some not actually pathological. It's just one of the many signs. So when you have unusual headaches, persistent ones, just go see your doctor. That's the best, especially after you've tried to treat it with the common drugs or treatments with the advice of your healthcare professional, of course, and it's not resolving. You might want to investigate further, is all I'm saying. There's nausea and vomiting also, and they may develop due to increased intracranial pressure. Seizures can be an early sign also. Even in individuals with no history of epilepsy, there may be subtle changes in awareness or sensation, or it may be full-blown convulsions. Then cognitive and personality changes also occur, when there are tumors that affect specific regions in the brain. These can include memory loss, confusion, sudden behavioral shifts, speech difficulties, either in understanding what people are saying or articulating words, especially if these tumors are in language dominant hemisphere. Also, motor skill impairments like weakness or numbness in limbs, trouble walking, or loss of coordination, all of these are possible. And your brain also controls your vision, your eyes. There are optic nerves that actually connect the eyes to the brain, also to the ears, so you can have visual or auditory disturbances, blurred vision, double vision, hearing problems, having a sensation of spinning, loss of balance, loss of consciousness, even coma can develop in severe cases. So all of these are actually symptoms, and they are not actually differential. Like, they might also overlap with symptoms of other diseases or other types of cancers. So the best thing is, once you notice an untoward behavior, feeling, symptom or sign, just please go see your doctor, go to the hospital ASAP, so that the right test can be conducted, because early detection is still very, very, very important when it comes to diseases generally, not just cancers now. And diagnosis can be done in different ways, from clinical examination by your healthcare provider, you telling them your symptoms, they making diagnosis based on that, before running some necessary tests, neuroimaging, like using the MRI, that's magnetic resonance imaging, to using CT scan, to using PET scans, all of these are very important. Then recently, molecular diagnosis have been used also. I talked about genetic changes that could actually result in tumors. So they use some types of molecular diagnosis to check mutations in some of the genes. Now to treatment strategies. The best for early detected, that's grade 1, grade 2, maybe brain cancers. So they do surgery, surgical resection. That part of the brain that has the tumor is operated upon. The tumor is removed as fast as possible, especially if it's benign, so that it doesn't impress upon parts of the brain that could affect some bodily functions. Also, radiotherapy is used for those that it will be beneficial for, in glioblastoma, in some astrocytomas, Then chemotherapy, that's use of cytotoxic medications to kill the tumors, chemotherapeutic agent. They also had radiotherapy to this, as adjuvant therapy. And some are so lucky that these medications will actually work. They'll go into remission, they'll kill the cells totally, that's the tumor cells. While some might not be so lucky, especially if it's malignant and it comes back, they may need invasive surgeries. Now, there's another called TTF, which is tumor treating fields. It's a novel FDA approved modality that uses alternating electric fields to disrupt mitotic spindle formation, that is at the level of cell division of those tumor cells. So this actually inhibits the cell division. Then there are targeted therapies and molecular approaches. These are newer ways to treat these cancers. We have immunotherapies, vaccine-based therapies as well. And now let's look at advances in brain cancer treatment in 2025. This is the silver lining I was talking about earlier, because this is not just about creating awareness, it's to let you know that work is going on brain cancer treatment, and to let those that might have it or know someone that has brain cancer know that there is hope. There's light at the end of the tunnel, after all, especially for the most malignant one, which is the glioblastoma. There are innovative therapies, there are technological advancements right now that aim to combat brain cancer. There is the pre-surgical use of tumor treating fields. I mentioned tumor treating fields as electric emitting fields used to treat the tumors. Now, there's a clinical trial in Manchester, UK, that is exploring the use of these TT fields, which is a wearable device which emits low intensity electric fields prior to surgery for glioblastoma patients. This approach aims to disrupt tumor cell division earlier in the treatment process, potentially extending survival and altering the standard treatment timelines. Okay. Interestingly, this was reported by the Times magazine that just released the Time 100 Health list for 2025. So this advancement is being followed closely. Then there's also researchers at University of Southern California that have initiated a study on novel gene therapy for glioblastoma. This therapy employs a more precise delivery system that is designed to target tumor cells while minimizing harm to healthy brain cells. This represents a significant step forward in gene-based treatment, and this is courtesy of Keck School of Medicine in University of Southern California in the United States. Yeah, so they're looking at actually targeting some specific genes that favor the growth of these tumor cells so that other healthy cells will be spared, because one disadvantage of chemotherapy is that they may not be so specific. They destroy anything on their path. That's why cancer patients on chemo come down with so many side effects, hair loss, they have some skin changes, they suffer infertility for those that are willing to give birth. So it's a lot. But with the advent of this targeted treatment, the healthy cells are spared and those side effects may be reduced or become non-existent in coming years, which is a good news actually. Then there is optimized chemoradiotherapy protocols. This is a mathematical modeling study that has proposed alternative dosing schedules for chemoradiotherapy in malignant gliomas. So, by adjusting treatment intervals and dosages, the model suggests potential improvement in patient survival and reduction in side effects, offering a personalized approach to therapy. I just talked about side effects of chemotherapeutic agents. Now, they are looking at using mathematical models to dose these chemotherapeutic agents in a way to improve patient survival and reduce side effects. I think that is great. It's great news, actually. Then there is another advancement called sonobiopsy for non-invasive diagnosis. Okay, these advancements focus on ultrasound technology, which has led to the development of a technique that temporarily opens the blood-brain barrier to allow tumor biomarkers to enter the bloodstream. You see, the blood-brain barrier is barrier separating the brain from the blood, literally, so that things in the blood do not just filter directly into the brain. It's a protective mechanism which could also be a stumbling block to some therapies, okay? But with this sonobiopsy, it aims to enhance the detection of glioblastoma markers through liquid biopsy, facilitating earlier and less invasive diagnosis. Liquid biopsy, you pass some things through the blood that will touch the brain, and by recovering it back from the blood, you're able to get if there are tumor markers in the brain. That is beautiful. Now, there are repurposed drugs as well. I've talked about drug repurposition and how it is beautiful for science, where you can use one drug for many indications. Yeah, bearing in mind the side effects, of course. So there is this repurposed drug regimen that is being worked on, which combines low-dose temozolomide, which is a cytotoxic drug for chemotherapy, with 9 repurposed non-cytotoxic drugs to target multiple pathways involved in glioblastoma growth. Preliminary studies have indicated that this multi-drug approach may inhibit tumor progression and improve treatment outcome, as reported by a scientist that carried out that research in 2024. Then there is the rhenium-183 nanoliposome radiotherapy. All these scientists would understand better, okay? It's just to let you know that researches are going on. Newer drugs, newer approaches to treatment are also going on with promising results, okay? Let me not just go too deep into all of those names so as not to bore you. Then we're looking at immunotherapy and vaccine combinations as well. There are clinical trials that are going on to investigate the combination of immune checkpoint inhibitors and vaccines to treat recurrent glioblastoma, and there are promising results as well from this front. There are also other researches that are looking at targeted therapy for pediatric brain cancers. It's a bad thing. It's very bad when a child has brain cancer, a child that is just starting their life, in the pain and all of that in their younger years. It's not something one wants to imagine. So there are therapies that are targeted for these pediatric brain cancers. They focus on some proteins that are crucial for tumor initiation and recurrence. And there have been promises to positive results in preclinical trials. These are the major advances that are going on in clinical trials. Some have even been approved by the FDA. The new drug for pediatric low-grade glioma, for example, the tovorafenib, has been approved, and is being in use with promising results. So these are majorly advances for now in brain cancer treatment. All right. I know someone might be wondering, well, we are hearing about these advances, clinical trials, all of them, majority of them are in the USA. When will they get to Africa? When will they get to Nigeria? When will everybody have access to it? Well, let's just be positive, right? The good news is that they are in existence, and sooner rather than later, I hope they will go around. Okay, I'm sure that there are foundations, there are NGOs, that are trying to make sure that these treatments get to the people that need them as much as possible. So just keep hope alive. And with the new technological advancements we have, drugs can get to the end user faster than they used to. So just be hopeful. All right. That is what I have for you basically on the commemoration of World Brain Tumor Day 2025. Remember that the theme for this year is United for a Cure, Advancing Research, Empowering Lives. So I've talked about various researches that are going on when it comes to brain cancer, right? This is just to let you know that there is hope for anyone suffering from this. The scientific community are working tirelessly. So please keep hope alive. We are with you. We are hoping to help. And if you have anybody like that in your environment, please do your best to just encourage them, be with them, offer them words of hope. All right. And that is it on today's episode. I hope that you learned a thing or two about brain cancer. I hope that you don't get it or any member of your family. Do your best to stay healthy at all times. Do not forget to share, to like, to subscribe to this podcast. Okay, always leave your comments. I would love to read them. Reach out to me via mail at antipharmacistpodcast@gmail.com if you have anything to say to me about the podcast, about collaborations and all of that. And if you're a social media manager willing to work on health content, I've said it, please reach out to me. I'm hiring at this point. I need your services, okay? Also, please follow on social media, on Instagram, on Facebook, on X, on TikTok, on all of those platforms, and on LinkedIn as well. Gwimsola DBC Joseph remains the name. I'll see you next time, guys. Till then, stay healthy and God bless you. Bye.